This is Dr. Fantaski with Atlanta Dental Implant Center. So today we've got a really interesting case. As you can see, our patient here has had, quote, more root canals than she has teeth, according to her spouse. So we've got a lot of bridges and some root canals and some crowns, but what we really noticed is that both of these bridges on the bottom are mobile. This bridge that's splinted between here, we're starting to have some abscesses on those lower teeth, and we basically figured out that that lower arch isn't restorable. So today we're going to be doing a full arch, all on 6 on this bottom arch, putting this all back together, and she'll leave us some beautiful temporary teeth that hopefully look better than this bridge that she had before. So stay tuned and we'll walk you through the process. Alright, so one of the things that I want you guys to really notice on this case is that these posts that were placed in both of these premolars, this one is perforating out the outside, so we expect, and we see the bone loss here on the 2D x-ray as well as the 3D x-ray, and we've got this big cavity that's up underneath this bridge, and then this post is really close on the outside here. So once we get in there, we'll get a chance to see what that looks like surgically, but that is one of the things that we're really looking at in particular on this case. So this is that bridge, and we grabbed it with our cotton pliers, and you can see all of those fiber posts just became debonded. So this whole thing just came out of one piece, and we were just left with these teeth broken off at the gum line. So we had to take those down and get all those roots out to get implants into these sites so that we can put her teeth back together. Temporary that just came out of the printer, so we're going to start by separating it off the build plate here to get a little stuck. Perfect. So we're going to start by just peeling off those extra supports. It's nice and warm. So this is isopropyl alcohol and a little squirt brush. So you can't submerge this ceramic resin. It's got to be brushed off. You can see we got all of our implants out nice through the center there, so all our screw channels are really nice. information from this morning. She's on her way home, and we went ahead and got her final x-ray here. So we were able to get all 6 implants in there in perfect position. Really happy with how that turned out. There was a substantial amount of granulation tissue out around where those posts were, so we had to spend some time getting that cleaned out, and of course all of the bridges basically fell apart in our hands as soon as we got in there and started poking at things. So basically going in there and trying to take out all those root tips, it actually took us a little bit longer than we thought to go ahead and get all the teeth taken out. Once we started placing the implants, everything went great. She slept very, very well. We joke lumberjack snores, and that's definitely what we got, but got everything worked out nicely, got our scans, and then as you can see here, our printed final temporary seated absolutely perfectly. So she's on her way home to recover, probably be back at work tomorrow. We, meanwhile, will see her in a couple weeks and make sure that the bite's perfect. So that is how we do a lower teeth in a day.